common side effects of starting HRT. I'm Dr. Jen, metabolic and hormone expert, and in this video I want to talk about the side effects of hormone replacement therapy. I'm not trying to make this video to say that there are all these side effects and you shouldn't take hormone replacement therapy. I think hormone replacement therapy is amazing, but I want you to know what to expect and what you need to look forward to, and then when to talk to your doctor about when there's a concern. So let's dive into the 5 common side effects of hormone replacement therapy. First of all, I want to say you should definitely talk to your provider if you're having any side effect, even if it's not one of the 5 that I'm going to talk about, because you never know. There might be ways to make adjustments. Maybe you need a different form, a different route. So talk to your provider to make sure that you're on the right plan. The first common side effect is bleeding. So that means irregular bleeding, right? When you're postmenopausal, you should not have any vaginal bleeding at all. And this bleeding can be things like spotting, or it could be actually having a heavy period, or even an irregular bleed where it's just kind of like 2 days of bleeding and then stop. If you're perimenopausal, it is kind of common to have irregular bleeding as you're going through that transition. So you can definitely have your cycles that get shorter initially and then start to get longer. And so if you experience irregular bleeding or a bleeding pattern that's kind of not your normal or been your normal, this could be due to a couple of things. First of all, it's really the estrogen or estradiol, the active hormone, is actually thickening the uterus. So normally, when you have a 28-day cycle when you're younger in your 20s, then the uterus is being thickened by estrogen, and progesterone is kind of stabilizing that lining. So if you're on hormone replacement therapy and you notice that you're having irregular bleeding, then it could be that your estrogen and progesterone are not matched, and that maybe you're on too much estrogen for you and you need to up your progesterone, or maybe you need to decrease your estrogen, or sometimes both. This is why it's good to work with a provider to make sure that you're figuring out what are the other symptoms that you might be experiencing. Now, irregular bleeding can actually happen the first 6 months starting on hormone replacement therapy. And definitely we don't get too concerned in the first 6 months as long as we're kind of making a plan and changing these things and we know that we're heading into the direction of having no bleeding if you're postmenopausal. That being said, we sometimes get an ultrasound to evaluate the uterus and the lining just to see if maybe the hormone replacement therapy is causing thickening and you might need an endometrial biopsy. So bleeding can occur in the first 6 months after starting HRT. Irregular bleeding is really kind of what is outside of your norm if you're in perimenopause, and if you're bleeding at all postmenopausal. And remember, postmenopausal is that you've had 1 year without periods, so 12 consecutive months and no period. So the second common side effect is breast tenderness. And so similar to what the uterus is experiencing when you have excess estrogen, and I say the word excess, but what I mean is they're not really matched, the estrogen and progesterone, then the breast tissue is stimulated by estrogen, and this causes breast tenderness. We use the term Mastodynia, but it's the same thing, essentially breast tenderness. And so similar to irregular bleeding, oftentimes you either need to up the progesterone or lower the estrogen, or sometimes we do both, depending on what your regimen is. And sometimes patients just have it for a couple of days when they first start HRT and then it gets better. I often suggest patients to kind of wait the full 2 weeks when they start to see if this breast tenderness resolves. If it doesn't, then we need to talk about maybe the regimen is not the right one. Number 3 is moodiness, or changes in your mood. So when you're going through perimenopause and menopause, you notice you kind of get anxious and irritable and annoyed and sometimes have apathy or just kind of feel depressed. And so hormone replacement therapy can help with those moods and make you feel a little bit more like yourself and have less anxiety, feel a little less depressed, overall helping a lot of different mood issues. In fact, depression is 4 times higher in menopause than it is when you're premenopause. But sometimes the hormone regimen isn't really the one that works with your biology or with your chemistry. And so you notice that your anxiety gets worse. I've seen patients who've said they've been woken up at 3 o'clock in the morning with terrible anxiety after starting hormone replacement therapy, or they felt like their mood was really kind of low and just not really motivated. It actually made their mood a little bit worse. So with any hormones, even when you're younger and you're on birth control, it's possible that that regimen doesn't really work for you, that it doesn't work with your chemistry. So it's likely that you'll need to switch. Could be the type that you're on, it could be the route that you're on. Is it transdermal or is it oral or whatever choice? So moodiness or feeling like you're not yourself is a common side effect that I hear. Number 4 is getting too sleepy, waking up feeling kind of tired and you can't get going. This is due to progesterone. So the beauty of oral progesterone is that it does help women sleep. Often when you go through perimenopause and menopause, you have changes in your circadian rhythm, changes in your GABA receptors to be able to calm your brain down to get you to sleep to stay asleep. Transdermal progesterone could potentially cause you to be a little sleepy, but mostly it's oral. When you start oral progesterone, sometimes it makes people too sleepy. Like they feel like they're out for 10 or 12 hours and they wake up feeling groggy. So this is usually due to progesterone. Now, I want to say, if you're having hot flashes all night and they're waking you up, for sure your sleep issues and feeling too sleepy is because of the hot flashes. So it's not a perfect science to say it's just progesterone. But commonly, if you're not being woken up because you have to pee, or you're having hot flashes, or maybe your husband's snoring, then that's usually progesterone if you're on oral progesterone. And there are a lot of different ways to change that. Sometimes we back it up and you take your progesterone a little earlier in the night. So maybe not at 10, but maybe at 8. Sometimes I do divide doses and have a dose when they go to sleep, and then if they happen to wake up, a shorter immediate release type of progesterone. There's a lot of different ways to adjust it, but feeling like you're more tired after starting hormone replacement therapy is not the goal. So if this is something you're experiencing, for sure talk to your doctor. And number 5 is it's not working. Like I started hormone replacement therapy and it's not working. Kind of a funny thing to say it's a side effect, but in a way it is. If you feel like you started estrogen, progesterone and nothing's happening, then it's likely it's not the right dose for you. It could be that you need higher doses, or maybe you only were started on estrogen, but you need progesterone also. So not working is a common side effect because there are women who basically just feel like that's not hormone replacement therapy is not for them. But you should feel a difference between starting it and not starting it. You should notice that you feel like yourself more, you're sleeping better, your energy is better, your weight is better, your brain fog is better, your hot flashes are better, your vaginal dryness is better, your joint pain. Oh my gosh, that's one thing I noticed with hormone replacement therapy was my joint pain was like so much better. Sometimes migraines get a little bit better. So there are options for hormone replacement therapy. If you feel like it's not working, you need to talk to your provider about making sure you're on the right regimen. And sometimes I do blood work to try to see where we are needing to go, the direction in which it makes sense to change someone's regimen. So if you're experiencing these common side effects, just know that these are common things and that your provider who is skilled in menopause care should be able to help you work through these particular side effects and find the right regimen for you. And maybe in the end, it may be that hormone replacement therapy is not for you, and that's okay too. It's about empowerment. It's about you making the choice that makes sense for you, you being your own doctor and your own advocate. So I've made this video really primarily to let you understand things that could happen with hormone replacement therapy and just to keep an eye out if you do start it. Please like and subscribe and let me know if you have any suggestions for future videos.